Welcome to Module 4. In this session, we'll walk through how to evaluate clearance across the three foundational zones of a Maxim 3D scleral lens: the central vault, the limbal zone, and the edge or landing zone. A successful fit begins with proper setup and a systematic approach to evaluation. Here are some patient prep and imaging tips. Before you start assessing the lens, get your tools and view optimized. Fill the lens bowl with ample fluorescein helps visualize tear thickness and vault profiles clearly. Use a bright white optic section on the slit lamp with the beam angled and height adjusted for a crisp sagittal view. If you have access to an OCT, use it. It provides highly accurate measurements and is particularly valuable at follow-ups. Now let's assess each zone individually. Number 1, central clearance. This is your primary read once the lens is applied. This is our recommended target. At application, we suggest approximately 300 microns. After settling, 150 to 200 microns. But remember, central clearance means measuring over the highest sagittal elevation, not just the geometric center. In keratoconus, the apex is often central or slightly inferior, so evaluate directly over the cone. In post-LASIK or post-RK, the mid-peripheral cornea may be the peak, so assess accordingly. Use slit lamp optic section or an OCT to assess vault over that highest point. If the lens is too shallow, you risk mechanical touch and corneal staining. If it is too deep, you may reduce oxygen transmission and increase fogging. Here is a fitting tip. If the clearance is off, move to the next lens in the fitting set. Each step increases sagittal depth by approximately 150 to 200 microns. For more nuanced changes, modify in 25 to 50 micron steps. Next is assessment of limbal clearance. This zone connects the central vault to the landing and is where a fit often needs the most finesse. Your post-settling target is approximately 50 microns of limbal clearance. Give special attention to the temporal limbus, as Maxim 3D lenses tend to settle slightly down and out. This area is often the first to reveal inadequate vault or sizing. We suggest using the limbal curve indicator or LCI. If the limbus sits inside the first line, the lens may be too large. If it extends past the second or third line, the lens may be too small. Here is what to evaluate. Touch or bearing suggests insufficient vault. Pooling or bubbles suggest excessive sag or poor alignment. Temporal asymmetry may call for quadrant-specific or freeform limbal adjustments. With Maxim 3D, the limbal zone can be controlled independently, allowing you to steepen or flatten by quadrant without compromising the central or landing zones. Next, let's evaluate the edge or landing zone. This final zone controls lens stability, comfort, and tear exchange. An ideal fit is gentle, even contact with the sclera. No impingement, no edge lift, no blanching. Interpretation. If you see edge lift, fogging, or debris, this means the lens is too flat. If seal-off or compression is present, the lens fit is too steep. Here are out evaluation pearls. Use low magnification with diffuse lighting to inspect conjunctival response. Observe each quadrant, not just the visible edge. Look for signs like vessel blanching or shadowing under the lens edge. We do offer some adjustment tools. Maxim 3D supports toric landings, quadrant-specific, and freeform haptics, enabling precise sculpting to match the eye's actual scleral shape. Our final thought is, each zone, meaning central, limbal, and landing, should be evaluated on its own. With the Maxim 3D platform, you have the ability to adjust each zone independently. That means you can optimize central clearance, refine limbal sag, or modify edge alignment without disrupting the rest of the design. This freedom gives you control, precision, and efficiency. No overhauls, no guesswork. Assess intentionally, adjust confidently, and let the lens conform to the eye, not the other way around.